The real issue with discomfort in the past had been my activities of daily living. Trying to get around and doing the basic things. You know, I live in a house, I have a garden, we like to garden, we're outdoor people, we like to get around and travel. A lot of that was challenging because of my compromised knees. I was limping, I was having trouble getting up and down stairs, crouching was an issue. It was very, very uncomfortable. I was doing a lot of extra strength Tylenol to keep my knees feeling okay. I have had 2 total knee replacements. One was done about 5.5 years ago. My most recent surgery on my left knee was done at RWJ University Hospital, Somerset, by Dr. Kayiaros. Dr. Kayiaros is absolutely fantastic. When I first met him, I put him through the ringer with a lot of questions. And I have to say, he really answered each one spot on and to my satisfaction. I felt a lot of confidence with him right after the very first visit, and we immediately scheduled surgery. Interestingly enough, a few hours after surgery, the aide came into my room and we walked around the unit. And subsequently, a few hours later, the aide came back and asked me if I wanted to walk again, and we did. And I have to say, we walked around the unit 3 or 4 times, did this. I would say we probably walked easily 1/8 to 1/4 of a mile right after surgery. You know, I'm not going to say it was fast, but it was really quite amazing how comfortable I was after the surgery. Following the surgery, of course, it's going to get a little stiff. It's going to be a problem. And it was probably about 4 or 5 weeks before my knees started feeling pretty good. But I arrived at home with a walker, and I didn't use the walker. I used the cane maybe for a couple days, but my knee was really, really strong and very, very, very pliable at that time. And now I'm at the point where 6 months later, I'm fairly mobile. I've lost a little bit of weight. Occasionally, I'm not going to kid you, I do get stiff knees, and I do take a little bit of Tylenol, but typically it's maybe once a day, and it's not every day. It all depends on what the weather is like and what the barometer is doing. But I'm thrilled with where I am right now. My mobility is much improved. And let me tell you, Dr. Kayiaros was absolutely amazing. The result is splendiferous, to say the very least. A vast difference between my 2 knees as far as how they function and how they work. I do have other mobility issues with some tendon issues on my left foot, so having a good, strong left knee is really, really important to me. And having that knee functioning has also taken some of the pressure off my right knee, so quite frankly, it's a win-win situation for me as far as my mobility goes. My life is a very active life, and not being active and being sedentary was not a good thing for me. The decision to have my knees replaced was an easy one. You only live once, and you have to make the most of it.